Hello guys, let me introduce myself. My name is Muhamad Nata Ijal Fikri. I'm from AAK Pekalongan. There, I will tell you about blood disease, that is stroke. Let's just watch the video. Definition of stroke. A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or burst. When that happens, part of the brain cannot get the blood and oxygen it needs, so it and brain cell die. A stroke is a medical emergency, and prompt treatment is crucial. Early action can reduce brain damage and other complications. Symptom of stroke. If you or someone you are with may be having a stroke, pay particular attention to the time the symptom began. Some treatment options are most effective when given soon after a stroke begins. Signs and symptoms of stroke include 1. Trouble speaking and understanding what others are saying. You may expression confusion, slurred words, or have difficulty understanding speech. 2. Paralysis or numbness of the face, arm, or leg. You may develop sudden numbness, weakness, or paralysis in the face, arm, or leg. This often affects just one side of the body. Try to raise both your arms over your head at the same time. If one arm begins to fall, you may be having a stroke. Also, one side of your mouth might drop when you try to smile. 3. Problem seeing in one or both eyes. You may suddenly have blurred or blackened vision in one or both eyes, or you may see double. 4. Headache. A sudden severe headache which may be accompanied by vomiting, dizziness, or altered consciousness may indicate that you are having a stroke. The last, trouble walking. You may stumble or lose your balance. You may also have sudden dizziness or a loss of coordination. When to see a doctor? Seek immediate medical attention if you notice any sign or symptom of a stroke. Even if they seem to come and go or they disappear completely. Think fast and do the following. Fast. Ask the person to smile. Does one side of the face drop? Arm. Ask the person to raise both arms. Does one arm drift downward or is one arm unable to rise? Speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or strange? Time. If you observe any of the signs, call emergency medical help. Don't wait to see if symptoms stop. Every minute counts. The longer a stroke goes untreated, the greater the potential for brain damage and disability. If you are with someone you suspect if having a stroke, watch the person carefully while waiting for emergency assistance. Causes of stroke. There are two main causes of stroke. 1. A blocked artery, ischemic stroke. 2. Leaking or bursting a blood vessel, hemorrhagic stroke. Some people may have only a temporary disruption of blood flow to the brain, known as a transient ischemic attack (TIA), that does not cause lasting symptoms. Ischemic stroke. This is the most common type of stroke. It happens when the brain's blood vessels become narrowed or blocked, causing severely reduced blood flow. Ischemia. Blocked or narrowed blood vessels are caused by fatty deposits that build up in blood vessels or by blood clots or other debris that travel through the bloodstream, most often from the heart and lodge in the blood vessel in the brain. 2. Hemorrhagic stroke. Hemorrhagic stroke occurs when a blood vessel in the brain leaks or ruptures. Brain hemorrhage can result from many conditions that affect the blood vessel. Factors related to hemorrhagic stroke include uncontrolled high blood pressure, overtreatment with blood thinners or anticoagulant, bulge at weak spot in your blood vessel walls, aneurysm, trauma such as car accident, protein deposit in blood vessel walls that lead to weakness in the vessel wall, cerebral amyloid angiopathy, ischemic stroke leading to hemorrhage. A least common cause of bleeding in the brain is the rupture of an irregular tangle of thin-walled blood vessel. Risk factor. Many factors can increase the risk of stroke. Potentially treatable stroke risk factors include lifestyle risk factor. Lifestyle risk factor being overweight or obese, physical inactivity, heavy or binge drinking, use of irregular drugs such as cocaine and methamphetamine. Medical risk factor, high blood pressure, cigarette smoking or secondhand smoke exposure, high cholesterol, diabetes, obstructive sleep apnea, cardiovascular disease including heart failure, heart defect, heart infection, or irregular heart rhythm, such as atrial fibrillation, personal or family history of stroke, heart attack, or transient ischemic attack. Other factors associated with a higher risk of stroke include age. People aged 55 or older have a higher risk of stroke than do younger people. Race of ethnicity. African Americans and Hispanic have a higher risk of stroke than do people of other race of ethnicities. Sex. Men have a higher risk of stroke than do women. Women are usually older when they have strokes, and they are more likely to die of strokes than are men. Hormones. Use of birth control pills or hormones therapies that includes estrogen increase risk. Complication of stroke. A stroke can sometimes cause temporary or permanent disabilities, depending on how long the brain lacks blood flow and which part is affected. Complications may include paralysis or loss of muscle movement. You may become paralyzed on one side of the body or lose control of certain muscles, such as those on one side of the face or one arm. Difficulty talking or swallowing. A stroke may affect control of the muscle in the mouth and throat, making it difficult for you to talk clearly, swallow, or eat. Memory loss or thinking difficulties. Many people who have had strokes experience some memory loss. Emotional problems. People who have had stroke may have more difficulty controlling their emotion, or they might develop depression. Pain, numbness, or other unusual sensation may occur in the part of the body affected by stroke. Change in behavior and self-care ability. People who have had stroke may become more withdrawn. They may need help with grooming and daily course. Stroke prevention. Many stroke prevention strategies are the same as strategies to prevent heart disease. In general, healthy lifestyle recommendations include controlling high blood pressure, hypertension. This is one of the most important things you can do to reduce your stroke risk. Healthy lifestyle change and medication are often used to treat high blood pressure. Lowering the amount of cholesterol and saturated fat in your diet. Eating less cholesterol and fat, especially saturated fat and trans fats, may reduce build-up in the arteries. Quitting tobacco use. Smoking raises the risk of stroke for smokers and non-smokers exposed to secondhand smoke. Quitting tobacco use reduces the risk of stroke. Managing diabetes. Diet, exercise, and losing weight can help you keep your blood sugar in a healthy range. Maintaining a healthy weight. Being overweight contributes to other stroke risk factors, such as high blood pressure, cardiovascular disease, and diabetes. Eating a diet rich in fruit and vegetables. A diet containing 5 or more daily servings of fruit or vegetable may reduce the risk of stroke. Exercising regularly. Aerobic exercise reduces the risk of stroke in many ways. Exercise can lower blood pressure, increase the levels of good cholesterol, and improve the overall health of the blood vessels and heart. It also helps you lose weight, control diabetes, and reduce stress. Avoiding illegal drugs. Certain street drugs, such as cocaine and methamphetamine, are established risk factors for TIA or a stroke. Okay, that's enough for me. Thank you for your attention. See you guys.